Good morning, ladies and gentlemen. Thank you very much for organizing this event, for having me on the panel, and for shedding light on a topic that is oftentimes forgotten and neglected. Counterfeit medicines also for WHO is one of the areas where we try to address it at a global level. How does WHO do that? They have developed a global surveillance and monitoring system in order to get a good understanding of what is going on at country level. But WHO is only as good as its member states and the governments and all the societies, as well as patient organizations, healthcare workforce, who actually engage in that area of work. For us, this is a topic that has to not only look after the safety of the patients, but also to promote the engagement between the healthcare worker and the patient themselves. So raising awareness, as mentioned today, is critical. And oftentimes physicians or pharmacists, they miss that moment where they can actually actively engage with the patient to make sure that their health literacy, as mentioned today, is increased and improved. I think coming back to what Professor Rafila said, is that the importance of the family doctors here in Romania cannot be underestimated. They are key when it comes to the relationship with their patients. It's a moment when you've got the patient in your praxis or in your cabinet, that is the moment where you can engage with them and to raise their awareness that when they go to the pharmacies or when they start procuring medicines online, that they're extremely careful regarding the source of the medicines and that it actually is to their benefit to make that additional effort. It also is even more important for people with comorbidities, where we have to see on how different medications interact, and oftentimes patients are simply unaware. The other point that I want to highlight is the importance of actually recording events when they occur so that they can be reported, so that the local authorities can then take the necessary steps in order to address it. So ensuring patient safety in regards to accessing safe medications is fundamental. And I truly welcome the efforts that are being made in Romania by all the authorities, including the Ministry of Health, in order to address this and to ensure that access that is being provided is safe. We often talk a lot about the importance of the healthcare practitioner, of the GPs, the doctors and the nurses, but I think today is a perfect day to underline the importance of the pharmacists and the moment when they engage with their with the patients that is there. It's very often one of those moments where they can actually share that information, where they can raise the awareness, and when they can invite the patient to look a bit more critically at the products that they are about to buy. So from a WHO perspective, I'd just like to underline the importance of this area of work and to thank you for making this day happen. And I'd be very happy to continue engaging in that collaboration and to also relate specific questions to colleagues that are at headquarters or at the regional office that have greater expertise. So thank you very much.
Thank you very much. Thank you, Doctor. You're right. The fact that people seem to still put some trust in the medical personnel is very good, and probably we should build on that. I would like to hear your opinion about what yourself and the WHO think about using those so much blamed channels of social media in order to reach exactly those few people, 7, 8, 11%, who, for reasons we don't understand, choose to put themselves at risk. Should we go directly to those channels in social media, to them?
I I love that question. And I'd like to draw a parallel to the context of immunization and people that refrain from wanting to get vaccinated, or also healthcare professionals that are not promoting vaccinations. I wish I had the answer to those questions, because ultimately all we can do is to continue to persevere, to share evidence-based information in a way that it is accessible to the population. Oftentimes, we spend a lot of time trying to think on how to reach that healthcare professional in order to invite people, for example, to get vaccinated, or here in this case to make sure that they do not take counterfeit medicines, just to make sure, to the people, to ensure that they are keen to get vaccinated, or like in this case, that they avoid taking counterfeit medicines and that they look at the efficacy of the medicines and the safety of the medicines that they're actually taking, and they take care of their own personal health. I think it's a notion of agency. People have to remember that they are agent for themselves, that they have the capacity to make an informed decision. It is our duty to provide that information to them so that they have all the information at hand. At the same time, it's very hard to convince them. And I think it's also difficult when it comes regarding social media and all the information that is out there to make the appropriate decision for oneself. I do believe that there is also enough official websites that are available, let alone WHO's, but also at the level of the ministry, the national authorities, etc., where information can be found. There are professional bodies that are available, the College of Physicians, the Order of Nurses, etc., the Association of the Pharmacists, etc., that can also provide that appropriate information. Seeking advice with healthcare professionals is the best way to go for any patient, and just making sure that they make the appropriate decisions for themselves. But how we reach them is my day-to-day worry in multiple areas. I'm a bioethicist by profession, so I'm not a physician, but being a bioethicist, I always have that intention of striving towards the ideal. So ideally, we would like to be in a system where everything is made available for the patient to be treated in a safe environment. And I think the only thing that we can do as healthcare professionals is to make sure that we strive towards ensuring that that system exists and that we invite people to access it, that we also foster the trust into the system, and that is an additional burden for us to often demonstrate that the information that is made available is actually trustworthy. But bottom line, being that idealist, what we try to keep doing at WHO country office here in Romania, in many of these areas, is we just persevere. We persevere, we persevere, and we persevere. And then with time, eventually, we're able to constitute that basic knowledge that people can tap into and they will then use to their own benefits. I hope I've answered your question.
Thank you very much, Doctor. Very convincing indeed.